And that is Mrs. Ashizi David Alu. She seems to have a lot of fans. Before I called her name, people were already clapping.
Thank you, Mr. Bumi. Good morning, everyone. I'm the State Midwife, Nasarawa State, Rotary RMCH, and I'm here to read out the recap. So yesterday was the first day, and it commenced around 8:45 with registration. All participants arrived, and we had our registration done. Afterwards, we had the welcoming remark from our boss, the Country Director, National Coordinator, Rotary RMCH, Professor Emmanuel Dolapo-Lufadejo. Afterwards, we had welcoming remarks from various stakeholders. Firstly, we had it from the Office of the Special Advisor to the President on Health, Director of Family Health, Federal Ministry of Health, Dr. Briam Ukraine. Then we also had it from the Executive Director, Primary Healthcare Development Agency, Dr. Mui Aina. Then from the Executive TA Connect, Dr. Lilian Anomnachi. Afterwards, we had goodwill messages from various stakeholders that were around, from the FCT, Primary Healthcare Board, from the State Ministries of Health across the 3 program of skill states, Gombe, Nasarawa, Ekiti, and the Federal Capital Territory. Afterwards, we had SIM from partners cutting across WHO, UNFAP, TA Connect, among others that were present. Then we had the objectives of the workshops read by Mr. Bumi Afolabi. It was supposed to be handled by Mr. Toyosi, but he was busy handling some other issues. Afterwards, we had keynote address. The first keynote address we had was from the Special Advisor to the President on Health, Dr. Salman Anas Ibrahim, and it was on the overview of maternal mortality in Nigeria, the importance of advocacy to reduce maternal and child mortality. Afterwards, we had we had group photograph alongside networking. Afterwards, we went for our tea break, and we returned with the commencement of the plenary session. And we had the first plenary session handled by Professor Hadiza Galadanchi, who was ably represented by Dr. Aminu Adowakili from Bayero University Teaching Hospital, Kano. And the topic was on cultural, economic, and systemic factors contributing to maternal and child mortality. Afterward, we had plenary discussion, and we had panelists drawn from various sectors, ranging from the Federal Ministry of Health, Department of Family Health. We had another panelist from WHO, who was Dr. Walter Kazadi Molumbo. We have a representative from UNFPA Nigeria, the country director, who is Dr. Gifty Adiko. Then we also had a representative from the state government, that is a representative of the Honorable Commissioner for Health, Gombe State, Dr. Habu Dairo. Afterwards, we had questions and answer sessions where justice were done to questions that were brought in by participants. Then we had lunch break and returned to continue with another plenary session on the topic updates on Rotary RMCH Together for Healthy Families in Nigeria Advocacy Efforts. And justice was done to this by our able country director, Professor Emmanuel Dolapo-Lufadejo, and Mr. Doyosi Adibambo, the program officer. And you believe with me yesterday that they did justice to it, telling us how far they've gone within the process of the few months that the project started, the success made so far in the 3 implementing states alongside the FCT. And afterwards, we had another plenary session, which lasted for 10 minutes. And we had participants from Nasarawa State, Ekiti State, Gombe State, and Federal Capital Territory, where we had the reproductive health coordinators of all states outlining the benefits gotten from the project so far, ranging from commodities that have been supported by Rotary RMCH to the states, support given to SSVs, support given through outreach programs by the use of the chiefs and choose agents that visit communities to look out for women that are at risk in pregnancies, and to also help educate them on things that are necessary to help them through pregnancy. And we also see most of them outline the progress and the benefits gotten from the joint outreach done so far. And the height of it yesterday in regards that was the success gotten in Ekiti by the government trying to create a new facility, and it's ongoing. The process is ongoing now just because of the need that was revealed during the joint outreach that concluded the last 2 months. Then afterwards, we had another panel discussion, which was on advocacy efforts on safe motherhood. And we had the moderator from the Federal Ministry of Health, who is the Director of Safe Motherhood, Dr. Samuel Oyeniyi. And the panelists were drawn from the Federal Ministry of Health, Dr. Said Dio. And we had another panelist from the National Primary Healthcare Development Agency. Then we had a representative from the TA Connect, who is Dr. Lai Jayola. Then we have the Director General, Ekiti State Primary Healthcare Development Agency, who was ably represented. Then we had breakout sessions for just to connect and to get to know ourselves better, after which we had our lunch, and and that was the highlights for yesterday. Thank you so much.
Thank you very much. Now, we would, without much further ado, yesterday we introduced our colleague from Rotary RMCH Germany. And so, all right, so that will come after Prof. So I would hand over the mic to Prof. He would like to say a few words before we take Rotary RMCH Germany. Please put your hands together for my boss, Professor Emmanuel Adedolapo Lufadeju. I think the applause can be louder than that.
We are still expecting a lot of the participants, so we don't want to waste a lot of time today. That's why we are starting now. I want just 1 minute to thank all of you for the love and affection that was bestowed upon me on my birthday yesterday. I want to tell you that it was not planned like that. This program was planned for 19 to 21 of November. Then I was told at the ministry that the National Council on Health meeting is going to hold in Maiduguri at that same time. And we didn't want to move it too much into the end of November, so I said, bring it back. And we looked at the date, it fell on 12th November. I said, well, there's nothing we can do. We have to go on. But you made my day, and may God Almighty bless you. I thank you very much. All the work of your hand will be blessed by the Almighty. Nigeria is going through a lot of trials and challenges. It will not put us down. We will always be on top by the grace of God. Thank you very much. I'm grateful.
Thank you very, very much, sir. Thank you very much. So, we introduced our colleague from Rotary RMCH Germany yesterday, and she would like to say a few words, at least tell us about her experience and how it all went yesterday in about 2 minutes. Please, let's make welcome on stage Ms. Daniela Kempfe from Rotary RMCH Germany.
Thank you, Bumi. So, good morning to everyone. So I'm not really prepared for this speech, so please bear with me. So my name is Daniela Kempfe. I'm working as a program manager with Rotary RMCH in Germany. So here I'm basically the counterpart to Toyosi Adebambo, managing the program of Scale Together for Healthy Families with the RMCH team in Nigeria. I'm very honored that I can be here in person in Nigeria to attend this advocacy workshop. All right. So first of all, I want to express my gratitude to everyone in this room who is supporting the program of Scale in their specific roles, and of course also to the hardworking RMCH Nigeria team, to Prof, to the midwives, to Yossi, Bumi, Greg, Mary. Thanks for always making me feel like I'm part of the team, even that I'm sitting in Germany. And of course, making me feel at home also here in Nigeria. So thank you very much. So for the last 1.5 years, I could witness from afar, from Germany, the success of this project. And I'm now very happy that I can get the opportunity to see it for myself. So I think after the workshop, I will have the chance to actually see some of the activities, and looking very much forward to that. So let us all work together to improve the health of mothers and children and to reduce the maternal and newborn mortality in Nigeria and hopefully worldwide, as this project has shown successes that this is possible. So also, I hope we will be able to further scale this program to other regions and to all contribute to this big and ambitious goal. So thank you very much.
Thank you very much, Daniela, for that. Okay, so now we'll go into the program, but there are just a few tweaks here and there, and it's all to make the experience great for us. You'd note where day 2 started, you recall that from yesterday, there was supposed to be a breakout session, which we said was going to be moved to today. Now, what we're going to do is, if you look at the program for today, after the recap, you have plenary session 1, which will be taken by Professor Oladapo Shitu. I will introduce him in a bit. We're going to take that once I'm done explaining all of these. And right after that, the next presentation, which is supposed to be plenary session 2, has been moved to tomorrow because the facilitator has an official assignment today. That is the one that's supposed to be taken by Dr. Aminu Magashi. So that will be taken tomorrow. So after Professor Shitu's presentation, we would now do the breakout session. So we'll do a combination of what we should have done yesterday and today, all at once. We'll explain in details when we get to that point. And then, of course, tea break, and then every other thing down there remains the same. It's important that we just mention that at the start of the program. So, without any further ado, the plenary session 1 is tagged the core of advocacy and various tools to work with. And he would be delving into advocacy skills training, messaging and framing, storytelling and testimonies and the likes. Please, if our hands are not too busy, as I hand over the mic, let's make welcome to the podium an astute obstetrics and gynecology expert. I mean, known here and known outside the country with many years of experience in obstetrics and gynecology in his field, and of course being known for having published several papers, several journals, and the likes. Please, let's make welcome to the podium the one and only Professor Oladapo Shitu. Please keep clapping till he takes the microphone. He hasn't taken the microphone. Please keep clapping. Thank you.
Thank you very much. Please permit me to stand on the existing protocol. I want to sincerely apologize for not being here yesterday. I was elsewhere on a major assignment and requested the permission of the organizers to be away and join this morning. Permit me to also congratulate the project leader, my very good friend, for the past 40 years. I say friend. That word friend doesn't actually match our relationship. He's my senior brother, and more and more and more. And I continue to admire and thank God for him, because this is somebody who has passion. And I say it again, he has passion for improving maternal and child health in Nigeria. Himself and Professor Robert Zinser in the Republic of Germany, the two of them in faraway US met and decided that was what they wanted to focus on during their respective governorship projects. Please permit me to mention this, because I'm doing it in order to stimulate us here to engage in one passion or the other that will benefit humanity. The two of them decided that they were going to make a difference in the lives of not German women and children, but Nigerian women and children. And what did they do? I was acting head of department, OB-GYN in ABU Zaria, 1984. And they decided, they came and met me and said they want to do a project. What was the title of that project? Child Spacing and Family Health. And you know what? This was at a time when there were hostilities in Zaria, Kaduna State, northern Nigeria against what? The concept and practices of child spacing, contraception, family planning, and related subjects. And where were we doing it? In the core of Zaria City. And in Samunaka, local government, on the way to Jos. We did it when there were hostilities. I don't know. Let me just cite one example. We went to one community in Samunaka area. You know what happened? We were carrying out community dialogue. We went in, because they had a boss for that project that time. We went with soft drinks. And when it was served, what happened? The people refused to drink it. So one smart chap told us, he said, you know what? They are suspecting there are contraceptives in this drink. Do something else. So we now sent for a local supplier to give us what? Supply us with soft drinks. And they took that one. Yes, I need to tell you this, because if you don't know where we are coming from, you wouldn't have received the full inspiration. And today, if you listen to Radio Kaduna, Kaduna State government is what? Using support from USAID to promote what? Family planning. Can you see the difference? So I want you to join me. I wasn't here yesterday when he was being celebrated. I want you to please join me to once again acknowledge the life and work of Professor Dolapo Lufadeji. Thank you very much. I appreciate you. This morning, I'm supposed to take us through this subject, the core of advocacy and tools for working it. And this workshop is titled what? Advocacy. Am I correct? Yes. But do you know the irony? When I saw the agenda, they gave me 40 minutes. Upon arrival this morning, they slashed it to 30 minutes. I'm sure you know where I'm going to. The core of this workshop. So the logical thing I did when I came was to plead for what? More time. I'm bringing this to the fore so that you can also join me in that quest for more time. And I hope you will oblige. Thank you very much. You know, I want to disclose my personal observation to you. I've been very privileged indeed to work with top-level operators at promoting major health initiatives in Nigeria. And one of our sore areas in this effort is the shoddy way we handle advocacy. The way we handle advocacy is far from ideal. I want to tell us that. And I'm very glad, I wish I was here and this presentation was being made here, where some very key, senior key players in the healthcare space in Nigeria were in attendance. And they will attest to what I'm about to say now. When we did, permit me to mention this, because there is a WHO Geneva publication that will soon come out in the next few weeks that focuses on it. So you're going to read more about it. On MPDSR, maternal and perinatal death surveillance and response, to which Rotary International has been a major contributor in Nigeria. And Rotary International was one of the leading partners that supported the enunciation of, or development and enunciation of a bill, a law that will, promote and enforce and institutionalize MPDSR, because it is a low-hanging fruit for preventing what? Maternal deaths and newborn deaths. But you know what happened? We thought we knew it. We embarked on advocacy. Advocacy to the National Assembly. But do you know where it caught up with us? During the during the public hearing of the bill. You know, the normal thing is there's first hearing, second hearing, and then first reading, second reading, then public hearing before the final reading. That's the law, the process for enacting any law in the National Assembly. So during the public hearing, there came clear expression of dissent from some arm of the stakeholders. And do you know what happened? It made us go back to what? The drawing board. What we ought to have done before, which I will be talking about in a minute, we now needed to go back to it. You get the point? We wasted time. It costed us additional resources. Do you see the point? So what we are supposed to do is to have a good handle on what? The standard methods for planning and implementing advocacy. I have many other examples, but permit me to just limit it to that because of time limit. So what we are going to do now, with your kind permission, is to take us through the standardized process for conceiving, planning, and implementing advocacy. If you go this route, you almost always succeed. And I want us to be as simple as possible. And in order to enhance this, I have shared my slides, printed copy with the facilitators, and I hope they will either photocopy it with us or share the electronic version with us. So you can follow it as I speak, and later on we can discuss during tea break. I'm sorry I've taken so much time, but I think it's essential we go through that introduction. Now, I want to apologize because I was trying to get rid of all these animations, but the technical people say I should just overlook it. This is the outline I want to follow. I want us to answer the following questions. What is advocacy? Why do we need advocacy? What makes the most effective advocate? Who makes the most effective advocate? And how should we go about, developing an advocacy strategy? And in this regard, there are 8 standard steps. And these steps I bring to us with all the credit to CEDPA, Center for Development and what? Sorry, I always forget the acronym. The Center for Development and Population Activities. It's a well-renowned, globally renowned organization. They developed this training manual, through accumulated experiences from North and Southern America. And it has served in many African countries. So that's why I'm very, very delighted and confident to share it with us. And the 8th step, number 8 step in this sequence actually focuses on evaluation and follow-up. So I'm not about to exclude it from the title I was given. And what I will do in due course, there is an illustrative example that I will use in order to foster understanding among, of the subject, the individual steps as I go on. Because I'll be making reference to that example as we go on. So, what is advocacy? The Oxford Dictionary gave us this definition: active support of an idea, cause, or proposal, especially the act of pleading or arguing for something. The act of what? Pleading or arguing for something. I want us to note that. So it is there's an advocate on one hand who has come to the conclusion and realization that there is need for something. And the person approaches who? Persons, targets that they know have the capacity to deliver that something. That's what advocacy is all about, in simple terms. So, advocacy embraces various activities undertaken to gain access to and influence decision makers on matters of influence to particular group or society in general. Now, what are the characteristics of advocacy? And there are 3 arms of this. Advocacy is at times used as a tool for citizens' participation. That is, you can embark on advocacy to a community to imbibe a strategy or intervention. Another one is what? As exercise of what? Power. In the US, for the past how many years, the major political parties engaged in what? Advocacy to the American people. To what? To vote for their candidates. And you saw what happened last week. Are you with me? That's another arm of advocacy. To do what? Exercising their power. And the third variant of use of advocacy is what? As a cumulative process. You imagine that, look, you want to build or establish a new paradigm in a location. For example, you want to expand the health insurance system. It's not something that you just get overnight, but you begin to what? Go from one stakeholder group to another in a process that will eventually, cumulatively deliver on what? An established and sustainable what? Health insurance program that will cover not the current 5%, but almost 100% of Nigerians. So, having said this, why do we need advocacy? At times, advocacy is needed to do what? To protect our personal interest, not collective interest. Like the President Trump and Vice President Kamala, they were doing it for what? To gain power for themselves. Am I right? That was where they were they took the leads in what? All the campaigns. Or it may be to what? To educate and provide public awareness on a challenging problem like what? Maternal mortality. Or it may be what? To promote a cause via public-private events. I use the example of health insurance because out-of-pocket expenditure on health care is prohibitive and non-affordable. So you may want to do what? Garner support for what? Enlarging that space to improve on what? The coverage of health insurance. So these are some basic requirements for engaging in advocacy. There must be knowledge, understanding of the space where you want to carry the advocacy message to. For example, you want to vie like President Trump and Vice President Kamala Harris. They needed to understand what? The population, the American people. And they did. Each one had their own what? Constituencies. They had their constituents very well. They had studied them. They knew what messages will resonate with their constituents. The same thing with us. You want to carry out advocacy, you must know the people who have custody of those resources. If you don't know them, you have failed on arrival. And how do you know them? You must do research. Various ways. You must research on who targets. I will expand shit on that. Educational opportunities, you must clear agreements within the group. Advocacy is usually conducted as a group. At times as individuals, but oftentimes as a group. For example, here we are. We are a group that will be advocating for one thing or another. All of them ultimately impacting on what? Improved maternal and child health. That's the ultimate. Now, so do we have clear agreement on this agenda in our group? We must establish it first. Otherwise, you'll find some of us working at crossroads, even within the same group. And what more? There must be what? Understanding of the political space. Because advocacy, call to advocacy itself is politics. trading in what? Political issues, lobbying, canvassing, all these things that politicians do. So if you say you are not a politician, don't even waste your time going into the realm of what? Advocacy. And what more? Availability of human and economic resources. Advocacy requires resources, oh. It does. We must not pretend about it. Anytime you want to embark on advocacy, please look for cash, ego. It is required. Otherwise, your effort will be dead on arrival. Now, who makes the most effective advocate? Those who share a personal connection with the issue. You see, if you want to get people who are likely to be most successful in advocacy, get people who are affected by the subject matter. Let me give you an example. If you want to advocate for the elimination of VVF, fistula, is it 23rd or 25th of May? Every year has been designated the day for elimination of VVF. Is it 23rd or 25th? I think it's 23rd. If you want to embark on such advocacy, get somebody who has what? Experienced it before. Someone who has, and the person will exude what? Passion. And the effect that person will have will be more far-reaching than you. I will talk about you belong to if you are not affected in a minute. So that's why it's important So this is one category of effective advocates in any cause. And that's why when you want to embark on any advocacy effort, look for people, include people, involve people who are what? Affected. Because they can always give you what? The personal experience to it. Some years ago, I was involved in a national foundation on VVF. It was chaired by Professor Kelsey Harrison. I'm sure many of us have heard of a globally renowned professor of obstetrics and gynecology. And one of our members was a university lecturer. And do you know what brought her into it? She had a gynecological operation. And during that operation, they inflicted fistula inadvertently. So she was leaking what? Urine uncontrollably. So that woman, you needed to hear her speak. When you hear her speak, she was treated, successfully treated. But when you hear her speak, her voice was louder, more impactful than the rest of us who were involved because of what? Our daily bread came from it. So now, the second group, those who could be impacted by the issue. Like me now, I was a stakeholder because I was just a gynecologist, obstetrician, who was involved in rendering services and what? Teaching medical students and postgraduates. So I was a stakeholder. There were other stakeholders too involved. Now, the third group, anyone who wants to make what? A difference. You remember what I said about Professor Lufadeju when I started my conversation? He is a very clear-cut example of what? A champion. He just takes the issue and runs with it. And we need more of such in our climb. Somebody is not, if you look at it, is a professional, is a professor of what? Agriculture. So he's not even OB-GYN, right? Professor Zinsa, an international economist. But they are what? Champions. I told you 40 years. And they have not what? Laid down. They have maintained it. Even going from what? Strength to strength. So if you want to engage in an advocacy effort, make sure you do what? You get these people on board. If they don't belong to these groups, then you have an outlier in your group. That person maybe the person is a logistician, but the person's effort may not be critical to your success. Now, how do we develop an advocacy strategy? An advocacy strategy is an approach that's aimed at getting someone in what? That is, you target your message, your activities towards any of the following. People who are in power, people who are what? Who have influence. People who are endowed with what? Resources. You want them to deploy what they have and invest it in what you are bringing to the table. That's what advocacy is all about. It's different from sensitization. Advocacy is about getting any of this. Let them commit it to your cause. So, to do something in the public interest that she or he will not have what? Otherwise done. So you want to draw their attention. Look, I want you to add this to your priority list. Invest in what? Family planning. Invest in what? Reduction of maternal mortality. That's why we have come. So the question is, how do you package it? How do you package your message in order to wrestle or to convince these targets to buy into your message? That's what advocacy is all about, how to carry out advocacy. And like I said, these are examples of thematic areas that advocacy may cover. For example, restoring funding to family planning budget. You know, in Nigeria, budgeting for family planning has been what? Like a sine curve. My brother here, Professor Muti here, will attest to this. He is one of the doyens of family planning in Nigeria. And he has been tracking the budgets and everything. And he's one of the unhappy people about it. So am I, but from a distance. But he is more in the forefront. Because, so it's been like this. Some governments will come, they will fund it. Others will come, they will just be silent on it and use it for what? You know, defense purposes. Then sponsoring cesarean operations. Oh, I was so delighted last week when the federal government decided that they will what? Sponsor cesarean. You know, do you know, after expressing happiness, the next thing I did was to calculate the number of women, children, families whose lives will be improved. Not just saved, but improved by that decision. I was so glad, and I thank God for it. My only concern, as in with many things, how are we going to do it effectively and sustainably? But if we get it right, mortality, perinatal mortality, so many things. And the quality of life of women and children will what? Improve. Now, share time to supervise PHC services. There are many other examples. Now, how should advocacy be planned? There are these 4 questions that have been crafted to help us to plan advocacy, how to develop and implement advocacy. Once we set out to answer these 4 questions, then we're on the right path to developing a full-fledged plan that will work and secure answers, responses for solving problems for which we're advocating. What do we want? What do we really want to achieve? Who has the decision-making power to make us achieve it? What do we need to do to convince that target decision maker? And lastly, how will we know if our strategy is working? You know, there is this saying, they say, is it movement, is it motion, no movement? Which one? Which one doesn't have, which one is what? Is motion without, thank you very much. I'm always challenged with that, getting it right. Motion without what? Movement. That may be the situation. You've developed a plan that is giving you what? Motion. You notice you are engaging in motion, but no movement. So you are not even inching closer to your objective or your result. So that is the answer to the number 4, as we'll see. So the answers to these questions will help us to conduct an advocacy campaign to understand why certain strategies are being used instead of others. Now, there are 8 steps involved in developing, implementing, and evaluating. And like I told you, these 8 steps were developed by a seasoned international organization that has gathered experiences from 2 continents in the Americas. And they have deployed it and used it worldwide with credible. When you live here, please just Google SEDPA. You'll see everything there. So I'm using a confirmed approach. Now, so the first step is to identify and analyze the problem. What do we really want to address? You see, that's the starting point. Because if all of you as a team, you see, these questions, these steps I'm raising must be addressed by the collective team of advocates. It's not by the leader. Everybody in that advocating team or advocacy team must engage in each of these 8 steps. So the first thing is there must be a very thorough analysis of an understanding of the problem that you want to advocate for or advocate on. If that understanding does not exist, efforts are dead on arrival. Please write this down. Secondly, formulate a proposal. What do we really want to achieve? There must be an objective. If you want to establish or develop a process, there must be an end point. What do we want to see achieved? For example, we want to see, the example I'll be using here, you remember I said I will use an illustration. We want to reduce maternal mortality. That's the end point. Abi? Thank you, sir. You see, Prof has put an indicator on it, an end point. Thank you, sir. We want to formulate a proposal that will equip us to achieve what? 25% reduction of what? Maternal mortality. Number 3, we need to analyze the decision-making space. This is one thing that where many of us fail. Early last month, October, I was involved in an advocacy effort by the NASCAP of Federal Ministry of Health. We were deployed in 6 teams to go to 6 states in Nigeria. I went to Oyo State. We were 4 in our team. The others went to the other states. What were we advocating for? You know, Nigeria is on the verge of achieving elimination targets on HIV. Nigeria is on the verge of achieving HIV elimination status. The 95, 95, 95. We're almost there now. And so, that's the good news. The target is to achieve it by the year 2030. But from all indications, we can even achieve it before then. You know, Nigeria is good when they want to work. But one of the secrets why we're achieving it is because we've been implementing it as a vertical program. Just like we did Ebola. Just as we did COVID. So in Nigeria, vertical programs almost always what? Succeed. Am I correct? The same thing with even polio elimination. Is verticalized. But if it comes to maternal and child health, it's mainstreamed. No, be so? We must know ourselves, situation analysis. That's what I want to avoid just being politically critical. But as a scientist, I must base my analysis on what? Evidence. So, having said this, we went, the government asked us to develop a work plan for integrating HIV response back into the healthcare system. Some of us were privileged to be involved in drawing the guidelines, the training manuals, everything. So we now went to this phase of implementation, which starts with what? Advocacy. So we went. And, you know, I stand before you telling you about what? The ideal way to plan and implement advocacy. But I regret to inform you that they just called us. They said, this is the date. It was just 1 week. And pardon, you are going to this, you are going to that. Prior plan. So we were on our own to do what? Develop plan. Even the names, some of the people who were following me to Ibadan, I hadn't met them before. Are you with me? No, I'm giving you, you see, we must know where we are. For us to be able to what? Transition to achieving success. This is where we are coming from. We don't have this planning of advocacy in our blood. It's not in our system. That's the conclusion I'm making. So I had to quickly put up some plan. The night before we started the advocacy, I had to compel all of us to do what? To meet, to fine-tune that plan. This person will be involved in logistics. This person will be involved in this. This is the message we will give. These are the people we must visit. Are you with me? All those work plans. But you know, I wasn't familiar with the Oyo State people. I Googled, but what would I get from the Google whatever? Very limited information. I ought to have researched about Oyo State government before going to meet them. But do you know how God helped us? They were holding an executive committee meeting led by the Honorable Commissioner when we got there, and she obliged us to come and speak. That was what happened. Those who were not present there, we had to go to their offices one by one to go on that advocacy effort. What we did was not scripted. They were supposed to have planned it before we even departed Abuja. All of us. We needed to be strategic about it. That's the point I'm making, and I want us to note that. So we must analyze the decision-making space. In that case, the Oyo State government we went to meet. We went there to sell to them that point that the federal government is about to what? Integrate HIV response in Nigeria, mainstream it into the healthcare system. Which means people living with HIV will henceforth be attended to in regular health facilities by regular care providers. Will collect their medications, have all their tests, everything done in mainstream facilities. It wasn't so before. Even the logistics of medications, the logistics for HIV testing kits and all that will also be mainstreamed into regular drug procurement systems in each state and facility. That's what integration implies. So we needed to what? Analyze that space. Who, how, and when will a decision be made in response to the proposal and by who? We needed to have analyzed this before going to Oyo State. Now, analyze channels of influence. Who are the actors at our target? Who actually takes decision in Oyo State? Is it the Commissioner for Health or the executive? Who? I once had a friend who was the Commissioner for Health in Niger State. No, a governor. He was executive governor of Niger State. You know what he did? He appointed somebody who studied PHE as Commissioner for Health. Do you know what he told me? He told me in confidence, but since he's no longer at the helms, I can share it. And I won't share his name. He said, you know what? He said, you know what? I want that person to always come and give me what? Information. I'm a surgeon. I'm the one who should be taking decision on health. So he's just there to like what? Occupy that position and do what? Thank you. There are some people like that. You will live here and think, oh, it's the Commissioner for Health you are going to meet who will take decision. But when you get there, you'll be shocked to find that the decision won't come from him. It's going to be from where? And in this day and age, where people are sponsored by some godfathers, even in political positions, they may not be the ones to take decisions. I hope you get the point. So we must study it to take decision. What mechanisms do they have for doing this? And the next one, we must do a SWOT analysis on ourselves, the advocating group. What potentials do we have to succeed? Are we really well constituted? Or do we just have people who boost the numbers, who make up the numbers, but cannot take on what? Decisive roles on this scheme. So we must know our strengths. We must know our weaknesses. We must know the opportunities and threats external to us that we can do or avoid, as it were. And we must analyze all of them towards achieving what? Success. If we don't do it, we have failed on arrival. Oh. Now, number 6, design advocacy strategies. By the time we get to this level, we are now ready to plan the strategies we are going to use. And how can we influence decision making in order to get the proposed policy approved? We'll just, when I go to the next segment, I will expatiate on this. I don't know how I'm faring on time. At times I get carried away by what I'm saying. I just want to pause and find out how much more time do I have? Okay, sir. You know I'm a teacher. So, design advocacy strategies. Now, after we have identified our strategies, you see, strategies is about identifying approaches that will give us advantage, that will speed up our processes towards achieving what? Our set objectives. That's what strategies are. And by the time we do the initial analysis I mentioned, we will now be clear. We know ourselves. We know the people we are going to meet. So what's left is about determining the most suitable approaches. And once we list out our strategies, number step becomes very easy. We must develop an activity plan. An activity plan is like a roadmap. It tells us what are specific tasks we must carry out, the sequence of carrying out those tasks, who will take the lead, who will be involved, and at what time, and with what resources. That's a full activity plan. So we must develop that. And once we have done this, the next thing is what? You remember what we said about motion and no movement? Once we start, we must ask ourselves, we must pause and say, come, are we really achieving what we set out to achieve? Or are we already failing? You know, the example I started with, the MPDSR bill, you know, because we didn't have any activity plan. We were just going until we reached what? That point where there was public what? Public, what's the name again? Public hearing. Thank you very much. And then and you know, once something fails at public hearing, there can be no third reading. So we reached the end. That was what happened. We now needed to do what we did. We needed to do what? Remap our stakeholders. Because what happened was some of our stakeholders went and expressed. Are you following? They expressed dissent in the public space. So we now needed to go back and rework our team. Those of us, we now needed to identify some stakeholder groups that we had left behind. We didn't include them. We now involved them. We now say, okay, now give us your own perspectives. We now included all their perspectives. The whole thing now became what? Comprehensive and acceptable to all the stakeholders. And you know what? The 9th Senate approved it. They approved it. It was read, reading, and it was what? Approved. That's what happens when you don't plan, you don't develop an activity plan for your advocacy strategy, and you don't what? Evaluate it as you go on. So what I did in my subsequent slide is just to expatiate on each of those ones. And I'm not very sure I should go into all of them explicitly. But when you get like this is the step 1 of those 8 steps. And I illustrated them. What do we really want to achieve? And I said we'll use examples. And but because of time, I will just keep. But there's something I will share with us here. This is what I will share with us. When you are, we want to develop an activity plan. Ultimately, we need we need to take decisions on each of those 8 steps. So what tool do we use to help us to make those decisions? Look, the example I said, the identified problem I said we want to address is what? 25% reduction of what? No, that's the objective. The problem is high maternal mortality, isn't it? And you see, we want to analyze the problem for our own understanding. Am I correct? That's the first step. So the question is, we now have possible solutions. What are the likely solutions for reducing maternal mortality? You see, I have put in these boxes 3 possibilities. One of them is to do what? Enunciate a law that will forbid what? Early childbearing. Is that not possible? It's a likely solution, isn't it? But we have to analyze it. Will it solve our problem? Is it feasible to achieve? Will our group become stronger if our advocacy group, will it be stronger if we embarked on that? Who will benefit from this solution? Doubts. What don't we know about this strategy? Another example is punish early marriage. Is it not possible? It's plausible. Am I right? It's a likely, it's a solution an approach we can consider. Am I correct? Theoretically. No, you see, when you are engaging in this analysis, you list everything that is possible. You now put it to the test. We are talking about all these questions. At the end, you will get the correct answer. But don't disallow any suggestion when you start. Are you with me? You see, this is how people establish creativity or innovation. Let everybody express what is possible. Are you following? Because you're saying yes or no, as initial response is because you don't have memory of it working. But the other person has come from another environment where it might have worked. Are you with me? So that's why you list all of them under this called possible solution. And look at the number, it's supposed to be number 3. Number 3 is what? Family planning. In our reading, they say family planning is capable of reducing mortality by what? 30%. So you can then ask the question, will it solve the problem? Is it feasible to achieve? Would our group become stronger? Who will benefit from this solution? What don't we know about family planning? So this is the first step. Now, after this, you will now have what? You will now further analyze the step that the possible solution that you have prioritized, using all these criterion to analyze them. Will it generate favorable public opinion? Do we have data to show that it will help solve the problem? And so on and so forth. And the first 3 possible solutions you derive from the initial long list is what you put here. So it gives you a comprehensive analysis of your prospects and chances of securing success if you embarked on this endeavor. Now, this is step 2. That is, you remember our step 2? Evaluation of the plausible. I remember the proposal is what? to increase family planning uptake. As I chose that from that our list. It's just for this demonstration. So we'll subject it to this criterion and analyze it. In what way does the proposal fulfill each of these criterion? In what way does the proposal fail to fulfill this criterion? What can be done to improve the proposal? So by the time we finish all this analysis, it puts us in good stead for success down the line. Now, so this is a summary of the step 2. Now, analysis of decision-making space. This is the most interesting part of this exercise. Because usually when we want to do, like I gave you the example of the Oyo State visit we did, when we knew nothing about the people we were going to carry out advocacy to. Now, what do we need to know here? The step here is to analyze the space in which a decision about the proposal will be made. And this step is purposed to identify who has the decision-making power with regard to the proposal, what the decision-making process will be, and the specific time frame within which the decision will be made. Now, this is the log frame we have for analyzing it. Who exactly has the decision-making power with regard to this proposal? Is he a political leader? Is he a technocrat? Is he a community leader? Is it an entire community? Who will make that decision? It must be very clear in our minds. Then, what process, formal or informal, will be used to make the decision? Is it an individual who should take the decision? Or are they going to take decision at a meeting, collective meeting? Or will they take decision through passing letter from desk to the other? Because your strategy will be different if any of these are applicable. What more? In what time period will the decision be made? Will they make decision immediately? Or will they make it over a long time? Or uncertain period? All these are also important. You remember our resources, the resources we are putting to the advocacy effort is limited, is finite. So we must be interested in what time to get to achieve our purpose. Now, so this is the summary of 3. Now, 4, channels of influence. Identify persons who have the power to influence decision maker, positive or negatively. If, for example, we identify that is an individual who will take decision, like Honorable Commissioner or governor, executive governor. At times it doesn't make sense to just go straight to him or her and say, please, we have come to advocate for blah, 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 blah. At times it doesn't make sense like that. At times you have to go through what? People who influence him or her. That's why you see many organizations, when there's a new governor, they quickly go and cut the first lady. Am I correct? Yes. If the first lady is known. You see what Elon Musk has been doing? You know what he did for President Trump? And now that man is the hot cake in the US. Everybody is looking for Elon Musk. To reach who? To reach Trump. Are you with me? So this is what we are talking about. We must analyze channels of influence over the key actor. We want to reach the key actor. Are you following? But how can we best reach him? Because there are some people, if you make the mistake of going through an enemy of the key of your target. What happened? Dead on arrival. Abi? That person is in the bad books of the decision maker or your target, and you go through that person. That's why we must be interested in what? That space, the dynamics in that state, in that him or her. People who have influence on him or her. And then we identify, allies, we identify opponents, and we identify what? The undecided persons. I've already explained that to us. If you don't do this, then you are doing trial and error, which may not confer success on your work. So, for the allies, we always agree on your proposal because of their interest in you or your effort. And so, convert their support into concrete what? Actions. Opponents will always oppose the proposals because of their interest. They are difficult to convince. It's difficult to convince them without modifying the proposal. Willing and unable to what? So take steps to minimize their impact. I suggested some of the things. Just look for very silent and smart ways of keeping them out of contention. Don't ever take them on directly. Never. Because if you try that, you are a loser. Just try and avoid them. So undecided ones, they are usually in the majority. They are the ones we want to get across to our side. And so this is the summary of it all. This is where we do the analysis, actors, and so on. Now, this is how we carry out the SWOT analysis on ourselves. I've also mentioned that because we must know ourselves, we must know our strengths, we must know our weaknesses, we must know how best to go forward with our agenda.
Thank you. Prof, thank you very much for your wonderful presentation and quite interesting. I have a little question to ask because I can see when I took over health promotion that is March 11th. So critically I was thinking how to carry out some work there. Then I thought as much as looking at, that's within the environment, especially corporately, banking, where we know very much that there are always, some money or maybe resources they usually map out for community services. And we see the level of taxation, even when you go to buy, we are buying currency, and no checking, and so on and so forth. I started thinking, how do we, make it that most of the health activities, even at every level, you don't see the banks, and they're having a lot of money. They don't want to, help in this society. I started thinking, how do I advocate to reach there? Though they are not low-hanging fruit, but we have a lot of resources there. So I now started going to bank. So the first bank I came, I now met the manager. So while we were discussing, he now asked me a question that they don't know the benefit of them going into health services to do one or this. So I started educating him the benefit. At least from when you are partnering with federal government or with Federal Ministry of Health, the trust in buying. And then I started giving him step by step. He was so impressed and so on. But I could see that level I was, it is not the decision-making level. And you know how profit-oriented all these directors, managing directors, they are. Yet we have our people that were they supposed to invest on, maybe even in this surgery, health insurance. So I would like to, raise it up here so that everyone will equally open our thoughts in that direction. How can, one come up with that angle of resource raising into our health interventions and projects? Thank you very much, sir.
Thank you very much, Ma. In fact, I must commend your effort for embarking on this strategy. It brings us back to what you just confirmed, analyzing what? The decision-making space. My wife was once a district manager of one of the big banks. And I learned so much from her. You see, decisions like this are not even taken at her level. They are taken at HQ, headquarters. Why? There are reasons for it. One, spendings. They follow all their spendings, all their liabilities to the letter at that level. Two, spendings on social causes like this. They keep a tab on it because it gives them what? Waivers on tax. So they have to collectively take that decision up there. So district managers, zonal managers, they only do what they've been asked to do. And do you know one interesting aspect? When election is coming, like the one in Ondo State this month, they will tell the district manager in that place to go and give a particular sum of money, to each of those political parties. The amount differs from the prospect of what? Winning. I know there are some bankers here, or former bankers or current bankers, even corporate organizations that invest in the political space. You get it? That's what they do. So we have to, it's the understanding we have of that at that level that makes us design our our advocacy approach. Because we won't even waste our time going to Abuja. We'll go to their head office in Lagos. That's what we'll do. And we'll look for influencers. We'll do power map. People who can influence that chief executive. Is it, who are they now? I've lost their names now, because they've changed. The first generation owners have handed over, like Zenith Bank and so on and so forth. People who can influence those key men, those are the people they use. Yes, some will even go through their churches or mosques or imams. Are you following? Because these are people who influence them, or their spouses, even their children. There are some men, if their children tell them something, they will do it until proved otherwise. So you have to do this research before you embark on it. I don't know if my comments are helpful. Thank you. Thank you very much. I was told one question, but no bets.
Sorry, Prof. I was following keenly. And please don't laugh at my question. I looked at the power map and those who could influence. In some environments, the people who can influence may require you to do something unethical. I don't want to put it more than that. How do you deal with that?
Thank you very much. I suppose what he means is like giving bribes. Yes. No, we must say it. In a forum like this, we are very explicit. You see, advocacy has its own ethics. And these ethics, they engender the likes of integrity, transparency, objectivity. The moment you begin to go under the table, there's no end to it. Even yourself, you will begin to know that, look, what you have got was bought. It was not earned. I hope we all agree with this. Yes. You see, the other thing I must say in response to this question is this. Advocacy, don't see advocacy as a one-off event. No. At times, it's cumulative. You may do it the first time, it may not succeed. You do it, you go back, you strategize. You do it again. I told you that of MPDSR bill. The first time we did, it didn't work. Abi? We went and re-strategized. The second time, it was even the minister himself who took it there. Are you with me? So that's the type of thing. If it didn't work the first time, the person who requested for bribe, don't oppose. Because that person, you classify that person as the opponent side. Because if the person is not going to support of his own free will, categorize him under what? Opponent. Are you with me? You don't need to bribe to get somebody on your side. Because you have deemed, your team has deemed it what? Worth fighting for, advocating for. Am I correct? So you're on the right path. Anybody who doesn't put them as what? Opponent. Look for ways of what? Bypassing them. Don't take them on. You just say, okay, sir, we have heard. Thank you, sir. That's all. But don't broadcast it to anybody. Yes, just neatly avoid that. When you go to you, sir, we are here. Don't make this again. Just go. Know that this was. Those people, they are smart too. Sir, am I? Thank you very much. So I think okay.
Okay. Yes. Yeah. That's right. Just a last experience, sir. Yeah, we had a similar situation where we were working in Plateau State. We were an advocacy group. So the main person we were targeting was the governor. And of course, we knew that seeing the governor for many reasons is very difficult. And that's where some of these tippings come in. But we had the power to continue drilling the commissioner because of our membership. The governor was somebody who could walk, the commissioner was somebody who could walk to and talk to him. So he now became our influencer of the governor. And we continued talking with him. And let me tell you, after some time, of course it worked. And money was released appropriately. We didn't see the governor for 1 minute. But the governor approved that the money be released to that facility. Therefore, what I'm saying is that seeing the governor, the list of seeing him is so long. And then secondly, they need you to bribe them before you see him and the rest of them. So we took another course and it worked. That may be something we may have to use from time to time. Thank you.
Thank you. So strategy. Yeah. Very, very important. We must strategize. And the strategy may work in one place, but it's not single method fix all. Look for strategies that have potentials to work. Thank you.
There's a round of applause for Professor Shitu. All right, so just before we go into the breakout sessions, to practicalize what we've learned today and even yesterday, I would like to take some accounts of how advocacy has worked in Nasarawa State. That is supposed to piggyback on this. So I have the honor and privilege to call up the Reproductive Health Coordinator from Nasarawa State, Mrs. Salome Vincent, to take us in that in just 10 minutes, and then we'll go to the breakout sessions. Thank you. Please, a round of applause for her.
Good morning, everyone. I'm here to just give an account of how advocacy works in Nasarawa State. And thank you so much, Prof, for that wonderful presentation. He talks about who makes the most effective advocates, where you must have those that are affected, the stakeholders, and the champions. And then how should advocacy be planned? Before you plan on any advocacy, you must have the facts and the data to work with. So for Nasarawa State, we have advocacy working group, which started as a family planning advocacy working group because we discovered that we have high rate of unmet needs, and we, as a state, then we don't have any budget line for family planning. So we decided to form the Family Planning Advocacy Working Group, where we have the combination of NGOs, CSOs, and even religious leaders in that group. And we were able to sit down with them, train them on advocacy for 5 days, and then we had to develop an advocacy brief based on the target population, target audience. So they use the advocacy brief to advocate for family planning budget for the state, and we were able to have a budget line as a state for family planning. They also discovered that the budget line was not enough to be able to carry out family planning activities in the state. They had to go again to advocate for an increase of the budget line, where formerly we would normally have like 5 million for family planning, and now we are talking about 30 million plus. So they are really working. So we discovered that family planning is not enough. We need to have them advocate for all the RAMCA activities. So instead of targeting them as a family planning advocacy working group, we now decide to change them to RAMCA Advocacy Working Group. And then when we have any issue to do with anything that has to do with reproductive health activities, they help us to advocate for that. We also got a grant from partner to also train them on budget tracking, where they track all the budget that are related to reproductive health activities. And then we discovered that media is also a very good advocacy tool. We also try to look at them. We were able to group all the media houses we have in the state. We brought them together and we trained them on family planning and reproductive health activities, what they are supposed to know about reproductive health. So we are now advocate to the owners of the media houses, especially those that are private, and then we also look at those that are government-owned. So we're able to advocate to them through using the advocacy brief and all the data we have to ensure that they give us a space in their media houses to be able to talk about advocacy. And then we have so many of them that were able to sign an MOU with us. Anytime we have anything to do with reproductive health activities, their doors are always open for us to come in. They give us space for media roundtable discussion. We also do a phone-in program in their stations, and then they were able to do like a commentary for reproductive health activities, where they run it in the state for people to listen and to be able to understand what we are doing. And then we also have what we call the Interfaith Forum. It's a strong forum that work and also advocates for reproductive health activities, because we discovered that when we now have the budget for reproductive health activities, and we have all the commodities that are needed for clients or patients to access at the health services, but people are not going, they are not accessing them. What is the problem? We did now discover that some of these religious leaders are also pushing back on all these things that we are doing. So we had to form the Interfaith Forum, where we identify the key religious leaders from each local government, and they were able to come around. We had to train them for 5 days, to tell them everything they need to know about reproductive health. We have a tool for them to use. We have the religious, the Christian perspective and the Muslim perspective of the tools, where they use them for all their activities. So we were able to train them for also 5 days, and we discovered we normally track all their activities in the churches and mosques. So most time when they preach, either in the church or in the mosque, they put it on the platform so that people will be able to see and then know what they are doing. And they now had to go to the local government to form the local government interfaith forum, where they do their activities at the local government level. We also have a strong SBCC technical working group that is working for the state. And then the chairman of that SBCC working group is one of our retired permanent secretary with the Ministry of Information. So he has all the knowledge and the background on what to do when it comes to advocacy. And then we are using them also for that. We also discovered that by the time these women from the community wants to access all these services, the men will not allow them to do. So that is where the community dialogue now came in to play. We now try to go to the community, involve all the men, religious leaders, community leaders, and then we sit down at the palace of the chief of that community, where we sit down and discuss family planning and other reproductive health issues with them. Some of them will tell you that they are not aware. They are thinking that when you talk about family planning, you mean women should not give birth. We said, no, you can give birth as long as you have the strength and the resources to take care of them. But this is our aim. Women should rest, and then you should be able to take care of them. So we do like a monthly community dialogue in the community that we know that have issues in accessing reproductive health services in the community. And then we also teach them what they are supposed to know and then sensitize them. From there, we were able to know that, yes, from this thing, some of them will tell you, when they go to the facility, they will be asked to pay money, even though we know that family planning services is free. But you discover that they still need consumables to be able to provide such services, and then the state is not supporting them with consumables. So we have to employ the use of community outreach, where we take commodities and consumables to the community, and then we sensitize them. Then you have a lot of women coming up to access the services. Thank you so much.
Thank you very, very much, man. It was important that we had that. Practical steps, and of course, using advocacy from different angles, from the community level, the traditional leader, the religious side of things, the media, and what have you. And I'm sure all the other states that are also here are doing similar stuff to get the same results. Thank you very much. Now we'll be going into the breakout sessions.